Sarel Gaur. So let's talk about low-hanging fruit in the field of artificial intelligence in radiology. There are a lot of problems in the radiologist's workflow that are basically just low-hanging fruit. These problems could basically be dealt with fairly quickly by a machine learning programmer. So just to give a background to all of this, a lot of radiologists are in private practice. They're used to dictating anywhere from 100 to 150 cases per day. And for every single case, you basically have to deal with a lot of low-level clerical type tasks. And it adds up. When you multiply this by 150 cases a day, it adds up to a lot of waste. So this is simply wasted time, wasted effort, wasted talent. It's basically taking a small portion of the radiologist's GDP and just setting it on fire. So why don't we do something about it? So the first item I want to talk about is basically, can we get a very brief clinical synopsis provided to us for the cases that we're reading? I remember being on chest rotation my first week as a radiology resident. And I remember looking at the history, and I often realized that the history was either blank or it had something completely useless in it, something like the word infiltrate. So I thought, surely this must be a joke. But it wasn't a joke. There were hundreds and hundreds of chest x-rays just like that, either no history or the word infiltrate. So how do you get around this? Basically, the only way you get around it as a radiologist is you have to spend time looking up the history yourself. It would be really nice if we were provided a clinical synopsis tool, basically a tool that provides a summary that we can review contemporaneous with us reviewing the radiological imaging. So let me take you through a process that I undergo every time I open up a case. Often I will open up the chart of the patient. I'll click on their name on Epic. Then I'll navigate to the patient notes. So I'll review a couple of the most recent progress notes. Then I might review a couple of the nursing notes because there's a lot of interesting information tucked away in there. I might review the labs next. Then I might review pathology, see if they have any diagnosis of cancer. I might check to see if they've had any recent surgery. And I might check to see if they've had any recent interventional procedures. So after reviewing all these different pieces of information on a patient, I basically summarize this information in my brain and then use it as I'm dictating the case to help me make a more meaningful report. So what I'm asking is, could an algorithm simply summarize all this information for me and present it to me as I'm dictating the case? Wouldn't it be nice if I had a clinical summary right there that said something like this? The patient is confused. They've been confused for years. They recently had an unwitnessed fall. They previously had a subdural hematoma evacuated approximately 10 years ago. And of note, the previous head CTs at this institution have either been read as normal or no change. Is it asking too much for this sort of information to pop up as I go to dictate the case? So let's keep going. Another piece of low-hanging fruit in radiology is basically organizing the hanging protocols. So radiology has become way more complex over the last 5 to 10 years. It used to be that an axial imaging study had a single series, but now most studies have minimum of 3 series for the multiplanary formats. If you're reading CTA, you might be dealing with 7 to 8 sequences, including reformats, 3D reconstructions, and MIP imaging. And if you're reading MRI, you might be reading 15 plus sequences because we're talking about multiphasic post-contrast imaging. We're talking about multiple phases of diffusion-weighted imaging. We're talking about subtraction imaging. So it really adds up. All of this intricate, delicate, highly advanced imaging is basically just dumped on your screen. And as a radiologist, you have to figure out a way to deal with it. Now, there is a way to set up a hanging protocol using the PACS. However, it's really cumbersome and it just doesn't tend to work well, especially if you're getting images from different scanners or if the technologists use slightly different protocols to do their scans or have different protocols from each other. So what I'm asking is, can we get a machine learning algorithm to help us fix this? I'm talking about a system where a human-like person reviews the images and sort of arranges them in a way for them to make sense. So, for example, if I'm reading an MRI abdomen screening for HCC, it would be nice if all the post-contrast images were arranged contemporaneously so I could visually see that a nodule is enlarging over time, and then I could be in a much better position to diagnose an enlarging HCC. So the last thing I want to talk about, again, nothing crazy, but it's basically low-hanging fruit, and it is basically filling in the quality parameters for CT scans. So for CT scans and for other studies, we have to basically report certain quality parameters. So for example, for CT, we have to report the dose. For fluoro studies, we have to report the fluoro time and the number of sequences. For IR cases, we have to report moderate sedation and the number of minutes of moderate sedation. So just to dictate the dose for a CT, again, it's not complex, but I've got to pull up a dose sheet on PACS. I've got to find the dose, and I've got to just dictate the dose right into the box. And it just seems to be that often dictating numbers like this creates errors, so sometimes it takes a couple times. Now, occasionally the dose sheet isn't provided by the technologist, and this requires a phone call so that they upload the dose sheet so that we can dictate the case. Again, it doesn't happen often, but it does take away from the time spent interpreting images. So rather than going after low-hanging fruit like this, for whatever reason, the programmers have decided to go after high-hanging fruit. Things like dictating cases from scratch, or accurately diagnosing lung nodules, or even more moonshoot type stuff, like predicting the likelihood of cancer that's present within a nodule using stuff that we can't even see on the screen, things like radiomics. This is all very interesting to read about, and it may result in something clinically significant, but there's a lot more clinically relevant, or just there's a lot more low-hanging fruit out there just ready to be taken. I think the AI researchers would benefit from talking straight directly to radiologists and just ask them, what are the real concrete problems in a radiologist workflow? What can we work through to make the process easier? So those are my 2 cents on this issue. I think there's a lot of low-hanging fruit out there, and I think it would make sense for programmer to try to focus on some of this stuff so that hopefully we can have a more straightforward and smooth workflow as radiologists. Sarel Gaur, MD.